Itchy, irritated, stinging eyes. Nearly 16 million people suffer from dry eyes in this country. But did you know dry eyes, they can be a sign of a bigger problem? Joining us is Dr. Betsy Fraser, optometrist and owner of Compass Vision Care, with more on symptoms, causes, and treatment. It's great to have you with us.
Thanks for having me.
So July is Dry Eye Awareness Month. I did not know this.
Yes.
And a lot of people do suffer from it. And I think a lot of people don't realize what it is exactly that's causing it.
Yep, correct.
Yeah, so what are some of the causes of dry eyes?
Dry eye is so multifactorial, many causes, as you mentioned. Sometimes it's related to maybe the eyes aren't producing enough tears. Sometimes it's related to allergies. Sometimes it's related to patients or folks who have trouble with bacteria. Inflammation is a huge cause of dry eye. And also, we all have these little oil glands in our eyes that most folks don't really realize, and the oil production or lack thereof is a big cause of it as well. Do
more men or women suffer from dry eyes typically?
Women more often. It certainly does not discriminate, but with aging and hormonal changes, women definitely are more likely to suffer from it.
Oh, I see. So we're kind of looking at ages 50 plus.
Yes,
typically.
Historically, that's been probably the population that's been most affected. But now with the onset of digital devices, we're seeing kiddos affected. We're seeing, teenagers affected, young adults as well, just because of all the screen time.
Right. Yes, and contact lenses as well. Is that a cause for dry eyes?
It is. It can contribute to it. So, a contact lens is a medical device that is on that eye, and so it is kind of limiting some of that oxygen that the eye is getting. So someone who's wearing contact lenses for a long time is probably going to be much more at risk for dry eyes.
Do dry eyes stand for a sign for a bigger problem that's going on in your body?
It can. Our folks that have inflammatory conditions, rheumatoid arthritis, a lot of autoimmune, diseases, thyroid concerns, Sjogren's is another big one.
Diabetes as well?
Diabetes, yep, absolutely. Someone with diabetes is going to be more at risk for dry eye.
So what do you do to treat it?
Lots of different treatments, and we're really kind of at an exciting time with our dry eye treatments these days. Historically, it's been eye drops, maybe lubricating drops. I spend a lot of time talking to my patients about all of the different types of treatments. Right now, we're actually doing IPL, which is intense pulse light. So there's some new technology that's out there. There's a lot of thermal heating technologies that are out there. So as I mentioned, we do IPL in our office, and we also do a radio frequency, which is like a hot stone massage.
Oh, for your eyes.
Absolutely. Yeah.
Interesting. I've never heard of that before. Is there ever a cure for dry eyes?
No. And that's the trick, right? It's a chronic disease. And so, what I talk a lot to my patients about is really our treatment. What we're trying to do is minimize, the occurrence of flare-ups, lessen the duration. Now, as I mentioned, with some of those in-office treatments, we can actually, reverse signs of damage in terms of the glands. We've never been able to do that before. So most of our treatments historically have been, let's kind of put a Band-Aid on it. Yes, there's some medications and drops that can help you increase your own tear production, but still that's never been a cure. Right. So it is exciting.
And I'm always a proponent, anytime something goes wrong with the body, is you re-examine what you eat.
Yep.
So would you say that maybe some of those risk factors could be attributed to your diet? And maybe
100%.
Changing things that you eat, maybe take an allergy test to see if you can minimize.
Absolutely. So, there's that whole adage of we are what we eat, right? So I think most of us are probably not getting the best anti-inflammatory diet. So that's a big part of the conversation that I have with patients, is really looking at anti-inflammatory, diets and foods, omega-3s, fish oil, good sources of omega-3s as well.
So the message for our audience is, if you're sensing that you have dry eyes, don't just live with it. Don't suffer with it in silence. Make sure you go see a professional.
Yes.
And you think about some of these other things, some of these lifestyle changes.
Absolutely.
Okay, wonderful. I want to thank you so much, Dr. Fraser, for joining us.
Yeah.
Appreciate it. We're back after this.